Dr. Baselga, Dr. Osborne, first of all, it's really great to see the two of you sitting together. We were just talking, Dr. Baselga, about the fact that so much is changing in the landscape of international research and the kind of dialogue that goes on a global level between researchers and physicians now in breast oncology. So we're coming off the heels of the most important meeting of all, the San Antonio Breast Cancer Symposium. Now you're gearing up for the IMPAKT breast meeting, the conference taking place in Brussels. So between the two of you, I'm curious to know where you see the common ground, some of the differences, in particular between these two meetings.
Well, let me start. I think San Antonio is the most important breast cancer meeting in the world. It's a phenomenal meeting. It's the place where all the new breast cancer advances, science, clinical trials is being presented. I'm very fortunate to be on the program committee. It's a great exercise. I mean, you see so much data coming in. So I think San Antonio is the must-go meeting when it comes to breast cancer. And it has a very unique formula. It's a formula that allows for interaction, very vivid poster discussion sessions, great posters. So it's a place for a lot of interaction. The IMPAKT meeting is a smaller enterprise and is directed towards the application of translational science into clinical trials. So the IMPAKT meeting is done together with the Breast International Group, and it's a meeting that is aimed specifically at trying to design better clinical trials, to train younger physicians. So it has more of an application edge than San Antonio, which is much more global.
And how many Americans do you expect to attend this meeting?
Well, a lot. I would think at least 20% or 30% of our participants are going to be North American. You know, the world is small. And breast cancer oncology is, we know how to travel around. We are really going back and forth all the time.
And we were talking before, it's almost like a team or a family of people now that doesn't make a difference where you live. If you're involved in breast cancer, we get together.
For you, Dr. Osborne, you've had this meeting, and now you're excited about some European data coming out of Ireland. The idea, you'll be going to Brussels to the IMPAKT meeting. Where do you see the synergy and the important connections between these two meetings?
Well, I think when you're attacking a problem like breast cancer and you're doing and you're involving multiple people, communication is the key. And so meeting frequently and interacting frequently and working together to design new clinical trials or to discuss science, that's the name of the game. And so I think having several meetings each year around the world where scientists and clinicians can get together to discuss all of this, and this is one of the important venues, I think is really important.
I'm curious about the impact on clinical trials and the global clinical trials because of these international meetings, allowing researchers and clinicians to be more closely aligned, I would think, would be a wonderful way to boost enrollment in trials.
We have a lot of trials that are worldwide. So we have North American investigators, European investigators, Asian. So some trials, important trials, are truly global. For those that are not global, what we are beginning to agree on is that we make similar endpoints so that we are making sure that we are going to be able to compare them. So we are building on joint platforms so that there is the capacity to really compare one with the other. So I think we have made tremendous strides, and I think in this regard, breast cancer is like your poster child of global collaboration.
You know, I think one of the things that you're getting at, in which both of these meetings have tried to do, has been to not only bring clinical researchers together from different parts of the world to do what Jose just said, but to bring the scientists out of the lab to work with us so that we can more rapidly translate what they're finding and what they're learning into the clinic to help patients. And Bill McGuire, who started this meeting 32 years ago now, was not a clinician. himself. He was an MD, but he was more of a scientist. And he was before his time, I think. I mean, he always believed that the research that he did should be immediately translated to patients. And so we developed this meeting with that in mind. We're somewhat successful at it. We've always had one room where everything is presented and the science is presented, and the doctors, if they want to hear it, they stay there. If they don't want to hear it, they can leave. But they stay, and the scientists hear what the clinicians are doing. And I think that cross-fertilization, which is what Jose's meeting also tries to do, I think has been very valuable. We're really working very closely now with scientists.
You know, on a personal level, when I listen to both of you speak and reflecting again, I was so young in my 20s with breast cancer, and it was 1983, and it was 2 years before CMF became the standard of care. And that I had a doctor way back who had the wisdom to really look at European data, and it was Gianni Bonadonna's protocol. And I think now how fortunate I was at a time when, as you talked about, you know, there was not that total trust and engagement with European research, and I benefited from that. I so encourage women, don't only focus on what we're doing in the United States. Keep your eye out. Be open and read about what's going on a global level. And that, to me, some great research comes out of Europe. And now, while the physician community is more and more embracing this global collaboration, I'd like to see patients embrace patient advocacy on a global level so that we as advocates are more unified, and that we also are open to understanding what's going on in the rest of the world.
I think the patient advocacy movement is an important one, and that is spreading. I mean, there are advocacy groups in Europe, South America. The Komen Foundation is spreading out its tentacles. And I think you're right. One of the major reasons that we have been successful and mortality rates are coming down, we have to give some credit to the advocates, their lobbying efforts, their educational efforts, and working together with them. It's really a community of scientists, doctors, patients, advocates, the federal government, which in our case provides most of the research money. All of these people working together has really resulted in the mortality reductions.
And it has not gone unnoticed by the advocates. Both your organizations have really embraced the advocate community. What you have done here in San Antonio is incredible, that the advocates are working side by side with clinicians in dialogue, and you have the patient seminar at ESMO, and you're both to be acknowledged and congratulated for helping to not only motivate, but strategically use patient advocacy in a way that enhances your ability as clinicians. So personally, on behalf of the advocate community in the US and Europe, I thank you.